energy is at the heart of what it is that we're talking about this morning. It's also forming a key part of our discussion, even though it's not in the way that we know it. We're looking at the supply of electricity to a key sector of our economy. There have been times when we've heard very awkward and very unpleasant stories of how in the middle of a surgery, electricity goes off and there is no generator, or sometimes, the generator was on, there's no diesel, or, university teaching hospitals are without electricity because they cannot afford the electricity being given to them, band A electricity, and it's so expensive, etc. We've seen all of these scandalous situations, and there are questions as to what exactly will be the new funding model for power in our health sector, not just government institutions, because we've also seen private health institutions cry out to say, look, this electricity being given to us, we cannot afford it. On the business model that we currently have, we cannot afford it. Well, we have someone here this morning who is also looking at these questions and perhaps also trying to find answers to them. We're joined by no less than the Minister of State for Health, Dr. Isiaq Salako. Dr. Salako, thank you so much for joining us this morning on Sunrise Daily.
Thank you very much, Makwe, and it's nice to see you again.
It's good to see you too. I do not know if you have any comments on this Dangote and Nupeng workers, but if you do not have, at least we're talking about the health sector right now. We're looking at what is happening with electricity and the complaints that we've heard so far, and what innovation is coming into that particular sector to see how we can solve the problems we have there with regards to energy.
Well, once again, thank you very much. And also good morning to Ayo and to all Nigerians who are listening. On this Nupeng, Dangote, Imbroglo as it is, my comment is to appeal for both parties to allow reason to prevail. The ordinary Nigerian must be at the center of the discussion. Like you have rightly observed, any strike by Nupeng will certainly disrupt a lot of things, economic activities, social activities. So we don't want a strike. So I would just appeal that a balance needs to be reached. Of course, Dangote is playing a very important role in the economy, trying to improve our domestic capacities and so on and so forth. And this is something that the government has also been promoting. Of course, there's also the right to associate and unionize, but that must be balanced so that it does not affect the business model that Dangote is trying to push. Of course, a strike by Nupeng will also obviously affect the health sector because as it is today, our hospitals are 65 to 80% dependent on diesel generators, petrol generators, and so on and so forth. So if there's a strike, it will also have an adverse effect on the health sector, and we obviously don't want that. Now,
that's remarkable. I mean, you just said that 65 to 80% of the health sector is run on diesel. That's a significant number.
Very high.
Are you looking at hospitals or facilities with the federal government, or is that a mix, federal, state, and private institutions?
Well, we do not have what I would call a total data outlook or look of all what is going on. We have some what I would call rapid assessment that has been done, some small surveys. As an example, we know that at the primary healthcare level, about 40% of primary healthcare centers are not electrified, based on a survey that was done in 2022, I think. We also know that in the private sector, a lot of hospitals, based on a survey that was done recently, that between 5 to 20 million per month is spent to buy diesel by private hospitals. And the federal tertiary health institutions, we carried out, on the average, our hospitals spend between 30 to 120 million per month to power the hospitals.
30 to 120 million?
Yes, sometimes more than that. So just an average.
And federal institutions?
Federal tertiary health institutions, yes. That's because when I resumed as the Minister of State for Health in the ministry, one of the first things I did was to try and have a better picture of what is going on at the service level. So I selected at least 5 hospitals in each geopolitical zone that I visited to interact with the workers and the leadership. And what is coming out is that a lot of them, in fact, I can tell you that in some cases, about 50% of their operating expenses is used to buy diesel on a monthly basis. So it is something that is not sustainable. It's something that we really must look at a solution to address it. And that is why when I finished my assessment, I decided that this is one area that I want us to focus on, and I put together a technical committee to look at the strong recommendation of that technical committee is for us to have a national dialogue where we bring every party together, private sector, public sector, experts, people, partners, development partners, NGOs, so people who can mobilize resources and so on and so forth. And that dialogue is happening for the first time tomorrow and next tomorrow on the 9th and 10th at the Abuja Continental Hotel at the Kwali Hall.
We're going to charge you for adverts, Honorable Minister.
No problem. I know that channel is strong in doing public good, but no problem.
Well, indeed, that conversation will certainly be one to follow. And we've been seeing that even within federal institutions, there have been conversations and even sometimes a shift, a radical shift. For instance, we just woke up one day and we heard that the State House was going to spend about 10 billion to move to alternative sources of energy. And people were wondering, what's going on? Even the presidency is shifting to solar. I'm sure that there must have been a discussion, even though there was no expatiation on why that was necessary. But if we're to go by what is already happening in many Nigerian households, and maybe the reason was not far-fetched with why the presidency or the State House was moving to alternative sources of energy. Only recently, I was privileged to visit the State House Clinic, and I found out that the car park was lined with panels.
Yeah,
it was saying, solar panels, and it was saying that they also moved to alternative energy. And I'm wondering, do we have we been able to find, will I say, examples, or will I say experiments to see what exactly the alternatives could be for us to be able to reduce the energy consumption? Because really, 55 to 20 million for regular hospitals, 30 to 120 million naira on energy alone is quite significant for our health institutions. So do we have any example? I'm trying to look for the word they normally use, like
best practice.
Best practice, okay. But like an example.
Like a pilot.
Like a pilot, exactly. Right. Okay. Where we have experimented what exactly could be possible, and an example that we can now replicate all over the country.
Yes, there are a few things going on really. The federal level, for example, the teaching hospital in Maiduguri is run purely on solar now, and they have so much that they can also give to neighboring communities to power their homes.
They have so much electricity, yes, they can give to
neighboring communities to power their homes, and that is solely.
How much are they generating?
I think they're generating in the neighborhood of about up to 10 megawatts. In the neighborhood of, I don't know the exact
solar
figure. Yes, by solar. And so they are, and also in the private sector, quite a number of people are already doing it. In Abuja here, I think there are a few smaller hospitals too, they are doing it. But what has also come out is that this approach to alternative energy is not properly frameworked and properly guided. It's being done in a haphazard manner as it is. As Minister of State, I've had a lot of private sector people approaching me saying that they want to do solarization of hospitals. And when I look at the policy environment, the guidelines, the framework that we have, there's no robust guideline that can properly protect the interests of government, the interest of the hospital, the interest of the ordinary patient. And it is important that at the start like this, we think very seriously about that and put that into existence. And that is also one of the main reasons why we're doing this. Of course, we also need to think about the implications of solarization. There are other implications. For example, there have been reports of fire outbreaks where you cite your solar panels is important. Some people don't know, We also need to think about the environmental impact of it, talking about my experience
Background,
as
yeah.
Minister of State for Environment, So all these also need to be properly brought on board. But more importantly, the pace, government is doing a lot, no doubt, but can government funding move at the right pace to be able to properly put in place a robust solarization project across all our hospitals? We think the answer is no. So it is also therefore important to look for partners, private sector funding. But we also know that in getting private sector funding, we cannot be looking at the typical kind of funding to achieve this. So we need to look for how do we get social impact funders who can look more at the social good rather at the profit part of it. So these are part of the conversation we were going to be having going from tomorrow to see how we can properly framework, how at a national level we can agree, local governments, state governments, the federal government, the private sector, and everybody is participating, partners, and so on and so forth.
Will the Rural Electrification Agency be there?
Yes, the
REA.
rural electrification. This is a conversation that we're putting together in partnership with the Minister of Power. The Minister of Power is going to be there. The Rural Electrification Agency, DG of Rural Electrification is participating. In fact, a representative of Rural Electrification Agency is part of the technical committee that I put together. And we also have quite a number of cross-government participation and also the private sector.
Because I'm a little curious, if for instance, as I said, nobody had the conversation with, or maybe that conversation was heard and I did not hear it, as to, whether we really can justify, for instance, I do not know how much the University of Maiduguri Teaching Hospital electrified its entire environment for, solarized its entire environment for. But if we're to go with what we know with the State House, and as much as 10 billion naira was spent, we have to ask questions as to whether the things that have now been installed will not require maintenance for as long. If we're to look at return on investment, so to speak, the ROI, how long will it take will it really make sense on the long run? Because we know that initial investments into alternative power can be pretty heavy.
Yeah.
And you have also made reference to it. So we need to be sure that, whatever pilot scheme we have in place or whatever it is we're using as our model, that over the years, we really can justify what it is that we're putting in the first instance, that, it certainly will make sense on the long run, not by speculation, but really by something that has been tried and tested in this instance. Do we have such example?
Well, the whole essence of this conversation is also to be able to have that robust conversation, discussion around. We have very good examples from some countries outside Nigeria, in the African continent. As an example, in Senegal, we have very good examples of efforts that have been able to support the solarization agenda within the health sector. And even some patchy experience is also on in Nigeria. Yes, the initial investment, like you said, is usually very high, but experience has also shown that if you're able to structure the funding very well, hybrid investment, funding model, you can also, on the ultimate, as an example, I can even cite myself as an example. In my house in Abuja, I don't use generator. If there is no power supply from the national grid, I use solar. And since I started living in that house in over 2 years, I do not have to have any problem with generator repairer. I have to have any problem with my gate man in terms of buying diesel and also. And I say that if I'm going to do 1, 2, 3, I must have recovered the cost that I used to do that solar in 2 years. So I think that yes, getting the initial investment may be huge, but it's something that I believe is worth investing in. But government funding may not be available to be able to do it at scale, and that is why we're looking for other partners that can support the fund. And we have quite a number of people who have come forward, but we just want to be able to get it properly frameworked in such a manner that we can deliver it to the best interest of Nigerians.
That's very important because, some people also say that included perhaps in this cost of electricity we're looking at, we have not also factored in the cost of corruption, sadly. Yeah. And that maybe if we were to look critically at it, we have to be sure that really it will make more sense for us to be on these alternative sources than even, buying diesel or being on AEDC or PHCN or whatever, government power supply, so to speak. But let me go to Lagos now, because I'm sure Ayo has questions for you. Ayo.
Thank you, Malkwe. One of the things that I want to, ask about concerns the first conversation we were having. We've talked about one aspect of which is that of power sector. We also understand that there is a threat by some workers in the health sector to also go on strike with some ultimatum. Can you confirm that, Honorable Minister?
Yes, the National Association of Resident Doctors have issued an ultimatum, but I think with the level of conversation that is ongoing, we had a meeting on Thursday, and we agreed that what they're actually asking for is the payment of outstanding from their residency training allowance. The federal government provides some kind of grants for resident doctors to be able to do the exams, the postgraduate exam, whether the national or West Africa. And about 40% of that for 2025 still outstanding. And that is really the main issue of the grounds of the resident doctors. But we are having a discussion on that, and I believe very strongly that we are going to avert any strike on that.
Is that an assurance that before the September 10 ultimatum, the issues will be resolved and there will be no strike?
That is my hope, and that is what we are working towards.
All right, Honorable Minister, there are a number of other issues, several other issues, that would disturb one. It's one other thing along that line, because we really can't afford any strike anywhere, particularly with this new strain of the Ebola virus that we have heard about. What can you tell us about that, Honorable Minister? Is there a cause for concern, or should we just still have our eyes, we can go to sleep with our two eyes closed?
Well, there is always a cause for concern, I must say, because the world is now a village. Technology has made it so easy for people to move from one end of the world to another end in less than 24 hours. So what is happening in far away Australia can easily come to Nigeria if we go to sleep. So our regulatory authorities, particularly the Center for Disease Control in Nigeria, cannot afford to go to sleep at any point in time. And I know that that organization continue to do surveillance, continue to make preparation for response, continue to carry out activities to prevent, to deploy commodities, put them on standby in areas that may be at risk so that response can be fast if there's an outbreak. That we continuously do. But specifically talking about Ebola, there has not been any reports in our country, but we continue to do robust surveillance to ensure that we prevent it, and if it should happen, we're able to respond very quickly to not so that it doesn't spread widely.
Honorable Minister, it will be good for us to know what those plans are, because I remember in 2014 was the Fashola government in place in Lagos at the time, and we understand that in collaboration with the federal government, there were some measures put in place by the Lagos state government at the time to ensure that, one, it didn't get in, and if it did get in, there are measures put in place to ensure that all the contact tracing, all measures are put in place to ensure that there isn't anything that blows out of proportion. Are there such plans now? I know you don't want to cause a stir, you don't want people to panic, but at the same time, it'll be good to know, because Nigeria is a new bride, so to speak, for investors. But then that also comes with such risks, don't they?
Well, what we have currently is that there are really routine mechanisms that are in place. Diseases are routinely reported, outbreaks there, to the health authorities at the local, and which comes to the state and to the federal levels, to the federal level. And there's a data platform where this is gathered on a quarterly and monthly and weekly basis. We also have at each state an emergency operations center where they are also able to meet on a periodic basis to evaluate and look at some of the reports that are coming from the field. And we have our monitoring staff on the field at the local level who are able to report outbreak and unusual outbreak in their neighborhood, in their center. And all this can serve as the information that feeds into the national platform that can trigger a more intense look. If there's unusual report, for example, of a fever-like outbreak somewhere, and that is captured and sent to us, then that triggers a more intense look at what is going on. And then if it's discovered that it's not something that is explainable, then you can then expand the activities of how to properly identify what is going on in that place. So that's the kind of thing that goes on routinely, every day, 24/7. That is going on. And it is when there's a trigger that we deploy more elaborate surveillance and detection mechanism to be able to see what is happening.
So can I just ask you then, I mean, tomorrow as you have this conversation of yours, what are you hoping will come out of it?
First, we need to do a proper understanding of the environment and how that impacts on the health sector. We like to also look at some best practices that has happened in other climes, including outside Nigeria, so that those best practices can also be discussed. We want to look at the end of the day, also come up with a compact that will be like our guiding principle that will take us on the journey, and also be able to put together a cross-cutting mechanism that will monitor the deployment of alternative energy in the health sector. A mechanism that involves the power sector, that involves the health sector, and also brings in the private sector, so that these things is better managed and better frameworked in a manner that it serves the best interest of Nigerians. So we hope that at the end of the 2 days conversation, we will be able to come out with that compact, and that compact will be like our commitment as a federal government, the commitment of the state government, the commitment of the local government, of the private sector, partners, into ensuring that we follow a defined path. And we also create a central data set for correlation of what is going on within the electricity sector in our hospitals.
Well, Honorable Minister, we certainly will follow up with you on this conversation after you've had it, and especially as you go into implementation. But we have to thank you very much for speaking with us this morning on Sunrise Daily. Dr. Ishaq Salako is a Minister of State for Health. Thank you once more.
Thank you very much. It's my pleasure to be here.